Hi, everybody. George Chamberlin here, executive editor for the Daily Transcript. Just finished off another roundtable, very interesting roundtable. It deals with the health industry in San Diego County, but primarily the construction and the work going on to make healthcare facilities, hospitals, and other things a much better environment and a more efficient environment. And very active conversation. James Palin was the reporter in the room, so you'll want to read his articles here on the website and in the publication as well. The roundtable was facilitated by Swinerton Builders, and joining me to talk a little bit about the roundtable is Mike Casey. Mike is a project executive with Swinerton. Mike, thanks for helping us out on this.
Thank you, George.
Wow,
Pleasure.
What an eye-opener it was for me to learn about all the things that are happening, the changes and challenges of providing hospital environments and the work that you do with a great team of partners, as you describe them, that are in this process. Talk about what's going on in the industry now.
Well, we do see a shift more so in with design build projects going in the healthcare industry. Traditionally, that hasn't been the case. So I'd say, especially with Sharp Healthcare, they push most of the projects going as design build. And it's been a real eye-opener for myself, not only for myself, my team, and for some of our partners in the industry as far as other contractors. It's more of a partnership approach. It's not the old traditional design, bid, build,
Sure.
Where you get into multiple claims and just tough projects. It's just a different mindset, and I really enjoy it. My team enjoys it. It takes a unique personality to do that type of work. Some people it doesn't fit.
You know what? When we started the roundtable, in my mind, I was kind of thinking, well, we're going to be talking about projects like the new Kaiser Hospital and some of the other things that are going on in there. But soon you brought up some interesting points about a hospital is a living and breathing entity, and from time to time it has to be changed and things have to be done, but you don't want to interfere with the primary objective of providing care to a patient in that hospital.
No, you don't.
So that creates a whole series of new challenges, doesn't it?
It does. You really have to break it up into two types of projects. You have the renovation projects of existing hospitals, which gets really, really tricky. There's excessive amount of planning, so a lot of staging. You want to be, again, as I said during the roundtable, you want to be behind the scenes, out of sight, out of mind, stealth-like, if you will, so that the patients don't see you, caregivers don't see you. It just creates a little more, tension in the environment of what's going on around us, and shutdowns and what have you. Now, ground-up projects, totally different, totally different. Ground-up projects, more so, I would say they definitely are looking at expanding to the future with respect to size of, the operating rooms and other use of areas, but also technology.
Sure.
Technology, you have to have that, and you really don't know where you're going to be 10 years from now, so you have to try to anticipate where you're going to be. So it's pretty tricky.
And that patient room today is much different than the patient room of 10, 15, 25 years ago.
Yes.
In a number of different ways. What are some of the things that you've seen in your career as far as that space that the patient in a hospital is involved with?
More so just a single patient room versus multiple patient rooms. I myself, my mother just went through rehab. She broke her hip, and my parents are now in their 90s. They've been pretty healthy to date.
I understand.
But it was a real eye-opener for me and the rest of my family to go through that process, and you really look around and you really start realizing, boy, I want to get her out of here as quickly as possible. And you go into some of the rooms, and they're shared by 2 or 3 other patients. It's not very personal. The family, it's very awkward. You're standing there in a cluster versus having an area to sit down, relax, really have some interchange. And it just lowers the stress level for everybody involved, especially the patient and my mom in that case. And you've been there.
Yeah, been there and done that. I know exactly what you're talking about. Yeah. You actually made a point right at the very beginning as well, Mike, that I think was really important. And again, this really struck home with me, is infectious diseases.
Yes.
And how important that room has to be to make sure that that person who comes in for situation A doesn't leave with situation B.
Yes, very much so. So pretty much the standard, all the construction employees get TB tests, and that's a standard requirement.
Sure.
Depending on the various projects and what you're going to be exposed to, or the patients will be exposed to. A perfect example was Sharp Mary Birch, all babies.
Yeah.
Some were, their immune system were compromised, and so we had to go through a second and third level of shots, if you will, to make sure we have the necessary clearances. And so there's that. There is, as you get into certain areas like OR rooms or OR corridors, you have to get into a bunny suit, almost like you've seen mold remediation.
Sure.
It's the same concept, but the reverse, where you're trying to keep everything basically combined to yourself. You literally go out from the area of work. You have to go into an ante room. You have to brush down with a vacuum. Secondary measures, everything has to be negative air, it's closely monitored. So there's a lot of work involved. So when you think of productive work, it's not really productive work, but it's safe work for the patients. So it's a lot of planning involved. I would say there's more planning involved for the actual work itself in many cases.
Oh, I can imagine. So we are seeing San Diego. Obviously, there's a lot going on here, but the need for hospitals and skilled nursing and other types of independent facilities probably is going to continue to be pretty sizable in the future.
I would say so. Yes, I would say so. I know there are some planned hospitals for the future here, near future. I know Kaiser's been talking about potentially a project or a new hospital tower up in San Marcos. There's been talk about something down in South Bay. Sharp themselves, they're putting up a 2 towers, I believe, down in Chula Vista, expanding their current campus. Outside of that, I don't know. So we're seeing the major push is really, like you were saying, are the MOBs, outpatient pavilions, and of course, skilled nursing facilities.
One person on the panel said, population keeps going up here. We're living longer. That's going to raise the demand.
That's going to raise the demand, and we're already seeing it.
Yeah. Mike, thanks so much. It was fun having you at the round table, and your help today was appreciated.
Most definitely.
Again, James Palin's the author of the work you'll see online here and in the print edition as well. Very interesting discussion. I have a hunch we're going to revisit it in the future.